So, reflecting on one of my deepest first reactions and experiences of caring for a person in a group that has been identified as being othered in healthcare is when in the ED treating patients that come in with alcohol intoxication, alcohol poisoning. Um, I know that happens frequently, but for the most part, nurses have these preconceived notions and biases toward the people that come in with alcohol intoxication. Um, I know one bias that I can identify that I hold is usually that these people drink to drown their sorrows. And many times, well, every time that they come in, I usually just take a look at them and try to figure out in my head what drove them to drink so heavily to the point that they had to come into the hospital for treatment. Um, but I don't know if that's a healthy bias or not to have. I always figure there's some underlying cause, something that triggered the drinking. That's the first thing I think of. What might have triggered the drinking in this case? Um, but I know I had one situation where a patient came in and the nurses were not um, had I already assumed that he had just been an alcoholic or had just had negative things to say about the patient because he came in intoxicated. Um, so I witnessed in the healthcare setting is that the nurses just assume that they're low lives and wasting their lives away, taking up resources in a hospital. Even those that come in ambulances, they're like, why are they using ambulances or coming in an ED, taking up resources and beds that other patients could be um, using. Um, yeah, in the case of my particular patient that I encountered during one of my clinical rotations in the emergency department, the nurses were very biased. It wasn't until the hospitalist came in and investigated the cause of the alcohol intoxication that the nurses changed their perspective on the patient. And they sort of checked their bias then. But let's see. Yeah, in the case of the Carl Scary article, as it's explained in that article, cognitive and affective biases in this case compromise the decision making process, and intuitive mode was used, and it's more commonly used because it's fast. It's usually effective, but it's also more likely to fail. Um, Usually characterized by abbreviated ways of thinking, as mentioned in the article. But in the ER, abbreviated ways of thinking are the norm. You have to be quick to look at the symptoms and try to assess why or what happened or what's going on. It's more focused. Um, yeah, um, the I've seen this many times before way of thinking. That is usually the case in the ER. Uh, yeah, and obviously in this particular case, that method of thinking failed, and bias was to blame. So in this particular case, this patient came in and he was criticized him for the nurses right away criticized him for being so young and so heavily intoxicated at such an early hour. It was about 9 in the morning, and it was a weekday, like a Tuesday. It was a Thursday, and so he came in on an ambulance also. So they were criticizing him left and right. Why did he use an ambulance? Couldn't someone just drive him here? Um, why do we even take these sorts of patients? They should just have um, like a place where they can be sent just for alcoholics, or just write it out, or no, just not nice things to say. Um, and it wasn't until the patient later revealed that he had lost his only son to childhood, pediatric cancer, the night before, that uh, he was drinking to help ease the pain, and realized that when he was already treated for the intoxication, that was a responsible way of coping with the pain of losing his son. Um, he was lying about his place of employment, and it was later brought to light, but he said he lied because he thought that the hospital reported these things to his employer. Later on, the hospital assessed that that wasn't the case, and that's when he revealed that he had been drinking heavily. The nurse reassured him that they would not report this also, and their attitudes toward him changed. Yeah, he said his son had been diagnosed a month earlier, and then he had lost him within 4 weeks. And with regard to marginalization, in the article 2019 article by in the Nursing Inquiry Journal, marginalization is when certain populations or groups experience multiple social determinants concurrently that limit their access to health care and health promoting resources and increase the risk of poor health. In this case, with my patient in the ED, he was later referred to social services, and it was concluded that he would have to see a therapist because he was put on suicide watch because it was later revealed by the patient that the reason he came in an ambulance was because his brother-in-law had called the ambulance, because the patient had told his brother-in-law that he wanted to die. He wanted to drink himself to death that night, and he nearly did. So after this was revealed, they considered him seeing therapist, psychologist, and yeah. So the marginalization of this group would have kept him from revealing such things. He would have just been labeled an alcoholic and a lowlife, and he would not have been referred to mental health for wanting to take his life through alcohol consumption due to the pain and loss of his son. He was like I said, he was criticized for coming in drunk in an ambulance early a.m. So what we can do to change the healthcare system to better meet the needs of this population would be to investigate the cause. Why are they even coming in drunk? Was it just a party? Was it just a binge? Or is there something painful that they are trying to drown their sorrows? And if there's anything we can do with regard to referring them to social work or mental health, because we have to address the root of the problem and not just the symptoms. It seems like the clinician, the hospitalist, knew what to do and what to address and to investigate further as to why he had been drinking. I know the nurses have to change their implicit bias and cognitive process so that they can ensure that patients in this typically othered group experience quality and equal health care. We can't just group everyone in this alcoholic lowlife type of thinking just because they came in intoxicated. There might be an underlying painful cause, and we have to investigate that further. So I think that's something that we could do just across the board, rather than just assume that they are drunkards. It might be something that there is hurting them that they're trying to get away from. Same thing even with drug overdoses. They might have done that for some underlying painful cause that they were trying to get themselves out of.